Yes, आइए. Good afternoon. Please take your seat. एक ही बटन बंद करके आना चाहिए. That would look कि खोल के वो बैठना है. That would be better. Your Masroor, Gayas. What does Masroor mean?
So the word Masroor means happy or delighted.
Happy. Okay. You are happy?
Yes, sir. I am.
Okay. Introduce yourself.
So I am Masroor Gayas. I come from village Mahipura, district Kulgam.
Mahipura.
Yes, sir. I have done my schooling from the district itself. Later, I did my MBBS from Government Medical College, Srinagar. I have also worked as casualty medical officer.
My interests include short film and translating Urdu ghazals into English.
You are a doctor.
Yes.
Why do you want to leave this medicine profession and come to general services?
So I have a reason. Like when I was pursuing my internship in the year 2021, which was a pandemic year also, I noticed several administrative lacunae within the healthcare itself. For example, if you allow me, I would like to quote an example. We had to, like after 4, I was posted at Bones and Joints Hospital, Barzula. We had to transport the patients for a mere ultrasound to SMHS hospital, and the reason being that a radiologist's room was not available in the hospital. So this seems so trivial issue, but there are so many administrative lacunae within healthcare, and I am sure in other departments of government also there would be many administrative lacunae which I want to fill.
But wouldn't a person with hospital administration degree holding the position of medical superintendent be able to handle these things? Why you?
Yes, sir. That is one of the welcome things that's happening. We have seen in the past hospitals are being administered by people who have masters in medicine or surgery. They are not experienced. But now we have things coming up like masters in hospital administration, where experts are coming to monitor or administer healthcare institutions. However, healthcare is beyond just a hospital. It is a broad framework which has social and economic determinants also. I have noticed those things also. So I would like to work in that domain. And also I would like to bring in Plato's corollary when he mentions that governance is like that working of a human body. If you know the disease and the health well, you can do things accordingly in the governance.
Okay, then what ails the health sector of JNKUT?
Yes, sir. So the one thing is the healthcare infrastructure. That is one. Second is skewed ratios. For example, if I talk about doctor population ratio or bed population ratio, that is there. Third thing is awareness among the people, general awareness and particularly healthcare awareness. That is lacking. And fourth thing would be a weak primary healthcare system, which is not in place. A good primary healthcare system would do well, and these are some of the issues which I can think of.
What is community medicine?
Yes, sir. So community medicine is basically about the preventive and promotive aspects of health, wherein we go into the community and try to see what are the social, economic and other cultural determinants which are having an impact on health or disease. And we also read about things like epidemiology and many other broad things are covered in community medicine.
How does this social and preventive medicine help in overall health care?
So community medicine is basically about the preventive and promotive aspects of health, wherein we go into the community and try to see what are the social, economic and other cultural determinants which are having an impact on health or disease. And we also read about things like epidemiology and many other broad things are covered in community medicine.
We are opening medical colleges in every district. That means the number of medical graduates would go on increasing every year now. Is it a good idea, or it will produce large number of medical graduates then who will not have jobs?
So as health is defined as a complete physical, mental and social well-being, and there are many aspects of health. One is definitely the curative part of it, which we have been taking care of in the past century or so. But then there are other aspects of healthcare also, like preventive, promotive, rehabilitative, and preventive and social medicine is where it comes into picture, the preventive part of it and the promotive part of it.
How has this health insurance or the gold card scheme helped the general population in India?
So it is I would say, a wonderful scheme to have Pradhan Mantri Jan Arogya Yojana, which is a health insurance scheme which covers around or provides rupees 5 lakh per family. Because when we see in healthcare is not affordable. There are two segments broadly. One segment is the one class of people who can afford good healthcare. They go to private insurance and all. But when we see a large segment of population, they are not covered by any health insurance. So I think health insurance scheme is doing good wonders.
What is this digital health mission?
Yes, sir. Another step which was taken in the year 2020, which was again the pandemic year, Ayushman Bharat Digital Mission was launched, which talks about digitizing the healthcare sector, where we will have a health ID, which is known as the ABHA ID for a patient. Every individual will have an ABHA ID, and
That is ABHA, ABHA.
Yes, sir. PPH.
What does that mean?
It's Ayushman Bharat Health Authorities.
Okay. Good. You have quite good knowledge about health sector. Now let's move to something general knowledge type. Can you name districts of Jammu division?
so there are 10 districts in Jammu division. One is Kishtwar, Jammu, Udhampur, Samba, Riyasi, Kathua, Ramban, Poonch and Rajouri.
Can you name the districts that surround Kulgam district?
So in the north we have Shopian and Badgam. Towards the west we have district Poonch. To the east we have district Anantnag, and to the southwest we have Rajouri. To the south we have Riyasi, and to the southeast we have Ramban.
Does Badgam somewhere touch Kulgam?
Yes, it has a border.
Where?
I'm not really sure on the ground, but I have seen on the map it has a border in the northeast of Kulgam.
I'm not sure.
I was also surprised, but on the map I have seen a border.
Okay. Area wise, which is the smallest district in J&K? Area wise.
Can I take a guess?
It's your neighboring district.
District Shopian.
There's a centrally sponsored scheme, PM Kisan. What is it all about?
So PM Kisan is about transferring around 6,000 rupees to middle and small farmers, small and marginal farmers. It is done through 3 yearly installments, 2,000 each. And it is to help them in providing agricultural inputs like seeds and fertilizers to make agriculture more remunerative.
A landmark is coming up in Riyasi district.
Yes, sir.
You have any idea about that?
It's an engineering marvel, which is the railway bridge which is coming up.
What is peculiar about that?
So the height of the bridge, it's said that it's more than the height of
This Riyasi district was recently in news for a mineral.
So Riyasi was in news because of possibilities of lithium being present in the district. Lithium, sir.
Why is lithium so important?
So given the changes in technology which are happening, when we see lithium-ion batteries and electric vehicles coming up, lithium plays an important role in that. So also we are dependent on lithium supplies from countries like China or other countries also. To have a lithium resource of our own, it would prove fruitful for India.
What are your views? Are we out of COVID now?
No, sir, we are not out of COVID. Only that the public health emergency has been declared, that there is no public health emergency of international concern. That was declared by WHO in May 2023, this year only. But we have a well-established COVID disease, and we know the broad contours of the disease. We have vaccines available, and we have treatment protocols also.
Who is Union Health Minister?
Yes, sir, it's Mansukh Mandavia. Honorable Mansukh Mandavia.
Good.
Thank you, sir.
Name the President of India.
Yes, sir, it's Srimati Draupadi Murmu.
So, nowadays, there is a common discussion regarding Uniform Civil Code. What are your views about it?
So I believe to have a uniformity in civil laws is a good thing, which also our constitution aspires. But only the time should be ripe for that. When the people demand, only the people's demands and the time will tell when to implement. As we have seen, the 21st Law Commission said that it's neither required and nor advisable to have a uniform civil code in place. But since there is a debate around it, I think only the time will tell when to implement.
We have a recently a political tussle going on in Maharashtra. BJP and Shiv Sena and NCP and Ajit, he has been made Deputy Chief Minister. What is the basis of all that? Why it is going on there? What is the basis?
So in my limited knowledge, what I know from newspapers is that some members from the NCP party, they have shifted sides and they have moved into the... Sorry Sam, I don't follow politics too much, so I'm sorry.
What are the political developments that are happening? That's very important to know. You cannot keep yourself aloof.
Do you know anything about United Nations organization?
You will not take any decisions on political pressures and other. That is good quality of a civil servant. But you cannot just wish away a politician. Because basically in our system of governance, he is the executive head.
He is the executive head. You have to deal him. You have to deal him vis-a-vis your guidelines, rules and all that. Without offending him. Without offending him, you have to do all these things. Can you tell me why United Nations organization was formed in 1946?
Yes, sir. United Nations organization was formed in the backdrop of the Second World War, which had led so much devastation in the world. To have an organization which would look into international affairs, peace, international peace and security, an organization was needed, and which was in the name of United Nations.
What were the primary members of this organization at that time? 1942 it started, it is. Who were the primary, who initiated this during that Second World War?
I think the victors of the Second World War, like United States, in 1942, sir.
It is prior to that, when war was going on, this concept has come. So who were the primary members of all that, of this at that time? 3 countries were there. You have not studied. Do you know anything about aims and objects of this?
Aims of United Nations.
United Nations.
Yes, sir. One is to secure international peace and security. Second is, there are broadly 6 divisions. And accordingly, we have different aims. For example, social and economic prosperity is there.
Then,
Fundamental rights are there.
yes, human rights.
Freedom of press, it is there. Human rights are there. Basically, most of the work of constitutions in the world have derived fundamental rights from the United Nations Charter. So you tell me, where is International Court of Justice seated?
Seated. It's seated in Hague, Netherlands.
Hague, Netherlands. Why? Because it is not. Otherwise, United Nations organization, they have headquartered in New York. Why they have made this seat of the... Do you have any knowledge about the International Court of Justice, why it has been?
I only know that most of the international courts, like International Criminal Court or International Court of Justice, all of them are seated in Hague, Netherlands, but I don't have an idea why it's...
Where first international conventions and charters were drafted and placed before the United. It is a...
That is some historical background.
जो मैं उसके बारे में आपको लिखवा दूँ. अच्छा आप मुझे बोलो कि जो हमारा ये रिऑर्गेनाइजेशन एक्ट है, इसमें हमें यूटीवी लेजिस्लेशन दिया गया है. ये किस यूटी के बेसिस पे हमारा यूटी फ्रेम किया गया है?
On the UT of Puducherry. Yes.
उनके पास क्या क्या है?
So they have a legislative assembly and not a legislative council. That is the framework.
Not legislative.
Yes, not a legislative council.
The legislative council is not. So many states don't have legislative council.
So one is legislative assembly and second is the lieutenant governor.
Lieutenant governor. Every UT is governed by the lieutenant governor.
Yes.
What is difference between the UT of Delhi and UT of JNK?
Both have assemblies.
Both have legislatures. What is then the difference between them and us?
In the state list, the subjects in the state list of like public order and police, and I think one subject is there which is there with the Delhi government and it's not with land is there. Yes, sir. Thank you. Thank you, sir.
Do you know anything about writs?
Sorry, sir.
Writs?
Writs?
Anything about the writ?
Yes, sir. Yes, I do know.
You have studied it.
Yes, sir, I have.
What is the writ of sorcerer?
So, certiorari is to
Be at ease, you should be confident. Don't bother.
It means to be certified. The literal meaning is to be certified, and it is in case of when a higher court tries to I'm not able to frame the word.
Certiorari is basically a writ passed by the High Court to quash
The judgments of the lower
any
courts.
order, act or anything passed by the...
There are two writs, certiorari and prohibition. I think prohibition is the one which is curative.
Certiorari is the cashment of. Suppose somebody has done a wrong act, it can be cashed, but that is the certiorari. Any wrong action by the government or lower court can be cashed by the High Court. This is the certiorari. Certiorari तो वही बोल रही है.
You have been a topper in 12th class, eh? Was it overall topper in the board examination? That's very good. Then you are from Mahipura. Why the name Mahipura given to your village? उसको बोलते हैं ना वजह तस्मिया. Any idea? सुना है कभी कि हमारे गाँव का नाम क्यों महीपुरा और क्या मही शहजादे क्या शायद समथिंग कोई नहीं जो भी है हर किसी गाँव के नाम के पीछे कोई ना कोई वजह होती है जिसे वजह तस्मिया कहते हैं रेवेन्यू रिकॉर्ड्स में उस हिसाब से वो थोड़ा. अरे कुलगाम की कोई इम्पोर्टेंट श्राइन्स का नाम बताओ.
yes, sir. So one is in the town of Kulgam itself, that is Hazrat Sayyid Hussain Simnania. Then there are shrines, Sayyid Nuruddin Wali at Simer. There's a shrine. Apart from that, there is a shrine in Vasikna Kund. It is Sayyid Azizuddin. Sayyid Azizuddin, I think.
Are you sure?
No, sir, Sayyid Aziz, I know.
Noor Shah
Noor Shah Wali. Noor Shah Wali.
If you are sure, then you should tell. Otherwise, दो बोले थे वो भी काफी थे.
चीफ जस्टिस हमारा कौन है हाई कोर्ट का? 2 जुडिशियल मेंबर है वहाँ पीएससी में, तभी मैं आपको बोल.
I think it's a lady chief justice.
नहीं यहाँ JNK का.
JNK में कौन चीफ?
गीता मित्तल थी वो तो कब
कहाँ चली गई? इस टाइम कौन है?
ये पता रखना चाहे.
जजेस की सिटर यहाँ हमारी स्ट्रेंथ क्या है हाई कोर्ट?
कोटेश्वर सिंह, जस्टिस NK सिंह और कोटेश्वर सिंह. कितनी स्ट्रेंथ है हाई कोर्ट?
कितनी है हाई कोर्ट की?
कितने जज है यहाँ के हाई कोर्ट में? इसका नाम क्या है इस हाई कोर्ट का?
High Court of Jammu and Kashmir and Ladakh and Duty of Ladakh.
तो हाई कोर्ट हमारा अभी भी एक ही है. हाई कोर्ट थी. सुप्रीम कोर्ट का चीफ जस्टिस कौन है?
So it is Chief Justice of India D.Y. Chandrachud. Justice D.Y. Chandrachud. So it is one Chief Justice and 33 puisne judges.
Are you sure?
1 plus 30.
1 plus 30 है ये.
30.
30 plus 1.
I think it was increased into 2019 to 34.
नहीं आप देखो अभी भी देखो. अच्छा तो मुझे
check
तो आप इसको चेक कर लेना सही तरीके से. आप मुझे एक चीज़ बोलो कि सुप्रीम कोर्ट को jurisdiction है to entertain direct writs under 32.
Yes, sir.
We have a writ jurisdiction to High Court also under 226 of the Constitution of India.
Yes, sir.
Is Supreme Court having more powers than the High Court in the writ jurisdiction? हाँ फारूक था खोवर कुन था गए अंदर कुन खोवर कुन अंदर आज.
Doctor Saab, you could have made a very good doctor. We are losing perhaps a doctor if you go to civil services. How do you rebut this statement of mine?
I think once a doctor is always a doctor. That's one thing. But second, I think I will bring my whatever insight I have about the healthcare sector. I would try to bring it into the administrative domain also and try to do good there.
आपका ऑप्शनल सब्जेक्ट क्या है?
So medical science.
मेडिकल साइंस ही लिया है ऑप्शनल सब्जेक्ट।
You would have been a very good doctor. You would have famous doctor in future.
वी विश यू ऑल द बेस्ट, यू आर डूइंग एक्सट्रीमली फाइन। सिर्फ थोड़ा सा पूरे इंटरव्यू के दौरान आपने अपने हाथ रखे एक ही बार, देयर शुड बी सम मोमेंट, जैसे ना बात नॉर्मली जैसे बात करते हैं, हाँ थोड़ा सा
as if you have a general conversation with anybody.
रिलैक्स
Any
फील
pressure,
करके थोड़ा
anything.
सा, और अदरवाइज यू आर डूइंग
No
एब्सोल्युटली
pressure,
फाइन।
no anything, none. Just relax, जैसे आप घर में किसी दूसरे के साथ conversation कर रहे हैं।
आपने कब कंप्लीट किया मेडिकल साइंस? तब से आप जॉब वगैरह नहीं मिला
ये
आपका?
internship
So मैंने किया था as casualty medical officer।
बाकी
नहीं,
नहीं किया।
PSC तब से निकला नहीं।
PSC ने
21 में सर मैंने दिया, this is my second attempt।
आप PSC में उस टाइम क्लियर नहीं हुए।
I failed prelims 2021।
ये इसका है KS का।
मैं बोल रहा हूँ जब
मेडिकल ऑफिसर का पोस्ट निकले थे,
Yes sir.
बीएससी के थ्रू वो आपने नहीं किया?
नहीं।
बिल्कुल नहीं किया।
नहीं सर मैंने नहीं किया।
नहीं किया। तो अपनी डाक के यू आर टेलिंग यू हैव एडवर्टाइजमेंट को दो बार किया। चलिए ऑल द बेस्ट।
Thank you sir.
मेरा 2 दिन में है अभी, तो what should I do?
2-3 जुलाई को
11th जुलाई।
बस नहीं, यू आर परफेक्टली ऑल राइट। बस
perfect,
जैसे
आपको need नहीं।
पूरा ऐसे नहीं, जैसे अभी रखे ना आपने हाथ, है ना, और पूरा ऐसे भी रख लो, कभी ऐसे कभी वैसे, कभी हाथ घुमा के।
you are good.
Otherwise you are
a good
absolutely
good
fine,
person.
किसी
You are
चीज की
absolutely
जरूरत
fine.
नहीं है।
अभी जो डे टू डे अफेयर्स के बारे में जो हो रहा, अभी मैंने बोला आपको कर्नाटका का, जैसे दूसरी जगहों पे जो लेटेस्ट
एक दो दिन के अखबार शखबार रोज पढ़ लेना,
अखबार पढ़ो इन दिनों, जो क्योंकि वो सुबह
नई डेवलपमेंट्स जो हो रही है, जैसे
इंटरव्यूअर सुबह अखबार पढ़ के आएगा, आपको पूछेगा।
महाराष्ट्र की बात है वो आ
यूनिफॉर्म
जाएगी,
सिविल कोड, तभी तो हमने आपको पूछा, आजकल चर्चा में है।
या ये गवर्नर्स के बारे में,
गवर्नर।
जैसे तमिलनाडु और केरला के गवर्नर, उनके पॉलिटिकल वहाँ के अपोजिशन का सेटअप है, उनके साथ इन चीज़ों पे बात हो सकती है इंटरव्यू में। बाकी ये हाइट वगैरह क्या है, श्रीनगर कितना है अबव सी लेवल, कुलगाम कितना है अबव सी लेवल।
एक्चुअली मेरा इंटरव्यू था 22 अगस्त को, 22 अगस्त। तो सिंस आई एम ऑल्सो अपियरिंग फॉर यूपीएससी मेंस दिस ईयर, तो मैंने एप्लीकेशन दी प्रीपोन के लिए, एंड नाउ इट हैज बीन शेड्यूल्ड ऑन 11th।
ऑल द
कोई बात
बेस्ट,
नहीं, YouTube
ऑल द बेस्ट।
यूपीएससी आपको फाइनल एग्जाम है, प्रीलिम्स
Means
मेंस देना है।
आई एम वेरी होपफुल यू विल
Qualify
qualify
that also.
both. You have the potential. Okay.